Back to it. Together for Health, stand with science, which obviously, focuses on maybe the possibility of a collaboration between science and, health. But looking at some of the numbers as to why anything that has to do with health becomes very important for us to discuss. In Nigeria, Nigeria's health sector faces severe challenges, with maybe the overview being the fact that life expectancy in Nigeria now is roughly 54 to 55 years old, with the average life expectancy for women somewhere around 54.9 and that of men 54.3. There's a very high infant mortality, where ranking amongst the highest in the world, there are 63 to 65 per 1,000 live births. While also showing maybe slow improvements, the system also suffers underfunding, a severe shortage of workers, where you have an approximate 20 to 10,000 population. That's the healthcare worker ratio, healthcare to citizen ratio, 20 either nurse, midwife, a doctor, healthcare personnel as aware to 1,000. That's a ratio of 1 person to 500 citizens. That's also one that leaves one with a lot of worry. Now, medical tourism, according to recent figures, estimates that in Nigeria, or Nigerians have spent $7 billion annually. $7 billion annually is spent on medical tourism in Nigeria. And then maybe the most disturbing part has got to be spendings in healthcare. I think I saw a report that says for most households, about 6 to 10% of the family income is spent on healthcare. But high out-of-pocket payments with increased investment in basic health is actually needed, because for most Nigerians, out-of-pocket payments is what we use in accessing healthcare, which has resulted in an expert stating at some point that most Nigerian families, and this is according to the expert now, most Nigerian families are one sickness away from abject poverty, which is a very damning report regarding. And I'm sure it's something maybe you can relate to if you have ever had a family member who was ill, maybe some sort of terminal illness, and how very quickly it can erode the finances of the entire family. So yes, we should be talking about health and possibly how science can help improve access to quality healthcare for Nigerians. But what are your thoughts on this as we look at the World Health Day? This health physician at the Federal Teaching Hospital in Ekiti. Good morning, Doc. Thank you so much for joining us on Factfile. Now, today is the World... All right, you're welcome. Thank you very much for joining us. Today is the World Health Day. What's the day all about?
Well, World Health Day is a culture that has been on the scene from last. It's about launching the year-long campaign celebrating the power of scientific collaboration to protect the health of people, animals, plants, and the planet. A new concept for a recent concept that has been renamed One Health. One Health is about the health of animals, the health of plants, the health of people, and the environment where they are found. And this One Health is about equilibrium. That there is an equilibrium that exists between all this set of nature occupants that I've mentioned. And once those equilibrium is tampered with, there's a great possibility that this equilibrium and this can tamper with any based on what I've just said. We're still pushing on expert quantity of resources, expert inadequate remuneration. For example, this morning the Association of Resident Doctors all over Nigeria are going on strike. Why? Because there's a particular agreement that was between them and the government is now turning back.
We just got on the phone with Dr. Abiy Okweyemi Oladipo, who is a consultant public health physician. He's a physician in charge of the Federal Teaching Hospital in Ekiti, Ise Annex. And we must thank you as well for being a part of the discussion. Ikechukwu, you joined us from Ogun State, Alaba. You called from Lagos. It is the World Health Day. Even if you haven't been paying too much attention to your health, today just take some time out to give the required attention to your health, because your body needs to be okay for you to be, all right. And that's it on Factfile for this morning. It's a production of Abiola Aberagba with assistance from Ose, Foluke, Elvis, and Ajoke. I am Oluwatosin Oshin. Good morning. Thank you for listening.